Idaho's News Channel 7. This is Viewpoint.
Welcome into Viewpoint. I'm Joe Paris. In this season of thanks, I'm reminded by a phrase that I heard a lot growing up. The phrase was, your health is your wealth. And it's the idea is, valuing health and healthy living so that we can get the most out of life. And healthcare, though, it's not always that simple. And I'm sure plenty of you know that. Coming out of the dark days of COVID, it was a real reset for many in terms of health coverage and plans and really what to do about it all. So there are a lot of questions out there in the community, especially for those who lost Medicaid coverage as the pandemic-era rules were relaxed. And if you didn't know, one of those rules involved the public health emergency declaration for the coronavirus pandemic. As a result, states like Idaho, they were forbidden from kicking people off of Medicaid because their income or other eligibility criteria had changed. But to help explain it all and to answer some major questions as we are getting through the open enrollment period, we have Your Health Idaho in studio today. And with us today is Pat Kelly, the Chief Executive Officer and the Executive Director of Your Health Idaho. Welcome back to the program. We appreciate your insight. I think the best place to start would be, what is Your Health Idaho?
Well, thanks, Joe, for having me. Your Health Idaho is Idaho's health insurance marketplace. We are a state entity, but we're not a state agency. And we're really here to help people understand what their options are for health insurance. And most importantly, we are the only place where you can apply for and receive a tax credit. And that acts like an instant discount to lower the cost of your monthly premium.
Mm-hmm. I'm curious, we'll get into a lot of the details here, but like in terms of a 50,000-foot view, the health insurance, the healthcare world, I mean, how crazy has it been coming out of a pandemic?
Well, it's been really busy this year. Last year, we had one of our most successful open enrollments, followed by Medicaid unwinding, which lasted all the way through the summer and has gone right into open enrollment this fall. So it's been a busy year. But one of the most rewarding things is being able to really connect Idahoans with health insurance that helps them stay healthy and avoid those unexpected things that can really cause financial hardship if they're not insured.
Because I know health insurance, I mean, it can be a big, scary thing. I know that sometimes you end up with a portal, there's lots of logos, there's lots of things. I guess who is eligible to be a part of Your Health Idaho? Is this any Idahoan?
Well, you do have to reside in Idaho. You are, in order to enroll with Your Health Idaho, you can't be eligible for Medicaid, Medicare, or have affordable employer-sponsored coverage. So that leaves a lot of people that may be eligible for that tax credit and to enroll with Your Health Idaho.
I know that there's always this phrase that you'll hear maybe in the office or around the community, open enrollment. For starters, what is open enrollment when we're talking about health insurance?
So open enrollment is the one time a year that you can enroll in health insurance for the upcoming year. So it started on October 15th. It goes all the way through December 15th. And that coverage would start on January 1st. Now, if you're to miss open enrollment, and we encourage people not to do that, it does mean that you have to wait an entire year to enroll unless you have a major life event. So think about getting married, having a baby, or moving.
And those major life events, I think, the insurance providers, they understand that sometimes there are changes, but again, this open enrollment window, that's really when people should be getting it done.
Yes, absolutely. And we encourage people not to wait. When folks hear that it's December 15th, they might think, oh, there's plenty of time. Well, it's going to be here before you know it. And it's really important to not wait until the last minute.
So we're about a month away from that December 15th deadline. Is that kind of an arbitrary date, or is that kind of like a real cutoff for the companies to, I guess, get all the paperwork done before the start of the year?
It is a very hard deadline. So midnight on December 15th is the last time you can enroll to have coverage for January 1st. The reason we do that is so that we can get those insurance cards out. People have time to make their initial payments for those premiums and make sure that they have everything in order for January 1st.
For you, as you walk through all this open enrollment, season after season, what sticks out to you about the hard work at Your Health Idaho?
So this is my 11th open enrollment.
Wow.
Some people may say I'm committed or should be, depending on how you look at it. But it's really rewarding. I talk with agents across the state. I talk with individual Idahoans, and many of them have health insurance for the first time in their life. So imagine a grandparent who is unable to play with their grandkids because they need knee surgery or they have hip pain. They finally get that health insurance, they get that taken care of, and for the first time they can play with their grandkids.
Oh, wow.
I don't think there's anything more important than that. And so that's what really keeps us going, whether it's me or the rest of the team, the folks that are on the phone, they just really care.
And when you talk about the team, I know, I was wondering if you're going through this for the first time, it can be a scary experience. You don't know what you're signing up for. You don't know exactly how it works. Tell me about the agents that work at Your Health Idaho and kind of how they help navigate that.
Great question. So we have a team of what we call customer advocates who can help you walk through the application process, help you navigate the system, and make sure that your account is in order. But what we really encourage people to use are one of our agents, brokers, or enrollment counselors, and they're located all across the state. We have over 1,000 of them, and they're in your communities, whether you're in northern Idaho, here in the Treasure Valley, or over in southeast Idaho. They're certified with Your Health Idaho, so they know how our systems work, they understand the plans, and they can walk you through and help you find the plan that fits your budget and your needs, and they're absolutely no cost to use. So expert help for no cost, that doesn't happen very often, and great to have those resources.
And it sounds like, as you described, that these agents are in the individual communities. It would sound like, Idahoan to Idahoan, you could have a more meaningful conversation than you might have with just some random customer service agent.
That's right. They are the trusted people in your communities, people that you may see at the grocery store or at the coffee shop, and they'll sit down, they'll talk to you, they'll find out what your needs are, whether it's both financial or medical or a little bit of both, and they will find that plan that works great for you and your family. And again, no cost to use. You can find them on our website, yourhealthidaho.org. Click on Find Help and enter your zip code, and a list of agents in your area will display.
And it sounds like these programs, it's not one size fit all. Tell me about how deeply can these medical plans be tailored to individuals?
So we have 154 different plans offered by 8 medical carriers. We also have 21 dental plans with 4 dental carriers. So lots and lots of options. And that's why working with an agent or broker is so important. They can help navigate, make sure that your providers are in network. They can help you find the right premium. And each of our plans are in a different metal tier. So we have bronze, silver, gold, and platinum. Easiest way to think about that is bronze is the least expensive to have, but the most expensive to use. And platinum is exactly the opposite, the most expensive to have, the least expensive to use. And we have additional discounts if you pick a silver tier. And those will lower the cost of things like deductibles, copays, and out-of-pocket maximums. So lots of choice. It can be overwhelming, and that's why those agents are ready to help you.
And I know 2 conversations are just 2 topics that go hand in hand, are health insurance and tax credits. I know people are going to ask, what type of tax credits are available through Your Health Idaho?
Yes, tax credits they basically act like an instant discount. They lower the cost of your monthly premium. We see 9 in 10 people that enroll with Your Health Idaho have a tax credit. And it acts like that instant discount. And it's based on where you live, your family size, and how much money you make. So they are tailored to your lifestyle, and then you find the plan that works best for you.
In terms of eligibility, I know that some people will ask about pre-existing conditions, and they worry, well, if I have some type of a condition, will I be able to be accepted onto this? They know what I might be treated for. Did pre-existing conditions, disqualify anyone?
Not at all. And that's why open enrollment is so important. As long as you enroll before December 15th, you can pick any plan that you want regardless of your health status, as long as you meet the other eligibility criteria that we talked about, not being eligible for Medicaid, Medicare, or affordable employer-sponsored coverage.
I know part of the reason we're doing this interview is to let people know as we get closer to the deadline, there are options out there. When you talk to people that don't really know about this program, are they surprised to learn about it, or are they relieved to find out there are options that aren't through an employer?
I'm always surprised that people don't know who Your Health Idaho is, because I've been there for going on 10 years. But when they hear about the opportunity that we present for so many plan choices and for the option to save so much money, they light up. And they really want to know how they can come in contact with us. How can they get that expert help? Super rewarding when that happens.
It's interesting because you and I were talking just before we started taping this. The agents, this must be really fulfilling for them to get to, actually help people in their community. It's not just a customer service job.
No, it's not at all. It is absolutely about helping your fellow Idahoans. We always talk about the fact that this is a chance to really make a difference. No one calls a support center to tell you how great you are, right? They always call with a problem or they need help. But when you're helping someone with something really important like health insurance, it's so rewarding. I'll often see our customer advocates maybe have a little tear in their eye and ask if they're okay. And it's because they've helped someone through a really personal experience and be able to get the help that they need.
Well, I know a difficult situation that some people are finding themselves in is the Medicaid unwinding, but we do need to take a real quick break. When we come back, though, we're going to talk about what the Medicaid unwinding is, and if you're caught in the middle of it or you don't understand it, how Your Health Idaho can help guide you in the right direction. Viewpoint returns right after a quick break.
Here's a holiday thought to ponder. Is it truly a wish list if you only have one wish? Here's to getting everything you're hoping for this season. Make your wish list a reality with exceptional offers during the season of Audi.
You already know RC Willey has a large selection of furniture, mattresses, appliances, electronics, and flooring. But do you know we also have a low price guarantee? RC Willey.
Sorry about that car accident. Got that insurance claim check for you.
I gotta call Swap. I gotta call Swap.
Here you go.
That's it? I'm calling him.
You forgot your check.
Craig Swap & Associates is on your side. We'll make sure you get the help you deserve, and we only get paid after you win.
One call, that's all.
208-999-9999.
From selecting the perfect produce and triple checking its quality to preparing it for you, we have perfected the art of fresh. Albertsons, the official grocer and tailgate headquarters of Bronco Athletics.
Welcome back to Viewpoint. Our guest this morning is Pat Kelly, the Chief Executive Officer and the Executive Director of Your Health Idaho. And Pat, as we were going to break, we brought up a major topic, Medicaid unwinding. I know we touched on it at the top of the show, but for those that may be caught in the middle or maybe not know about it, what is going on right now in Idaho?
So Medicaid unwinding is a little bit of inside baseball in terms of the terminology. But when the pandemic occurred in 2020, Medicaid eligibility was frozen. So if you became eligible for Medicaid, you couldn't be removed from coverage regardless of your eligibility. In February of this year, the Department of Health and Welfare began reevaluating eligibility. And they finished that formally on August 31st. About 43,000 people went through that eligibility process and were transferred to Your Health Idaho. And we enrolled about 14,000 of those individuals. So really tremendous response. But there were also almost 80,000 people who were ineligible. And we know that some have employer-sponsored coverage, some don't have any coverage at all, and that's why we want to make sure they know what options are available at Your Health Idaho.
So if somebody finds themselves no longer available for Medicaid, is Your Health Idaho like a good first call probably?
Absolutely. You can call us at our customer support center, 1-855-944-3246. Go to our website, and you can also complete an application. So the nice thing about Your Health Idaho is our application, once you submit that application, you find out your answer in mere minutes. So you'll know your tax credit right then and there, and you can go immediately in to shopping for plans. The whole process can take maybe 30 minutes in total, so really easy, all online, and super efficient for Idahoans.
And I know there's a standard of care and there's expectations that people had with Medicaid, and they've been on it for years. Now they find themselves off of it. Is it a difficult, transfer, or is it a pretty, apples and oranges situation or apples to apples situation?
Well, I think it's probably apples to oranges. It is different coverage, but the important thing is if you have a particular provider that you worked with while on Medicaid, you can make sure that provider is in network with the plan you choose with Your Health Idaho. To make it easier for Idahoans, we also have what's known as a special enrollment period all the way through November 30th. And that's for enrolling in 2023 health insurance. So if you've found out that you've lost Medicaid, you're no longer eligible and want to have health insurance through the end of this year, you do have an opportunity to enroll. And of course, if you're just looking for coverage for next year, you can enroll through December 15th for that effective date of January 1.
As someone who's gone through the open enrollment season, nearly a dozen times, what are some of the top questions that you see that you say, hey, these are great things that I wish the community could know?
So I think first and foremost, work with an agent or broker. It's complicated in terms of making sure that you get the right plan for your needs and for your budget. The application process is pretty straightforward, and getting that tax credit is in just minutes. But that plan that really fits your needs, that you keep for the whole year, working with one of those certified agents or brokers. Again, expert help, no cost to you to use, and you can find those on our website, yourhealthidaho.org.
And I know there are all kinds of specific situations we could get into, but one that caught my attention on the FAQ page on Your Health Idaho is the idea that if you work somewhere and your employer has health insurance, but it doesn't really fit your budget, are you still eligible to go to the health exchange and say, I'm offered this by my employer, but I don't know if that's the best option. I want to explore others.
Really appreciate that question, Joe. It depends. In January of 2023, the rules changed. So the key word here is affordable. So if your employer-sponsored coverage is deemed unaffordable, then you can be eligible for a tax credit and enroll with Your Health Idaho. And the rule that changed is that they now judge your affordability based on the employee premiums separately from your dependent premiums. And we all know that employers tend to have more funding for the employee portion and less for dependent coverage. And that can sometimes mean that the dependents are eligible for a tax credit and the employee stays with the employer-sponsored coverage. So it's a great option for people that have employment, but they just can't afford the premiums with their employer-sponsored coverage. They can enroll 2 times with Your Health Idaho, either during our open enrollment period or when their employer open enrollment happens. But the really important thing before they take any action is they want to do that affordability test. People are saying, well, what is affordability, right? So 8.39% of your income, that's the threshold this year in terms of how much you pay for the dependent or employee portion of the premiums. So really important that people kind of understand that. And again, working with an agent can help them.
And of course, all the information on the website that we were just showing, very easy to navigate, nice bright colors, easy sections to see. A specific question for you. I know that young people coming out of COVID, there's a different, view of health. Some are very into it now. And I know as younger people are kind of getting off mom and dad's health insurance plans, or they're graduating college, they're not really a part of that. What advice would you have to, kids in their 20s and 30s that maybe have never signed up for health insurance before?
We may think we're invincible when we're in our 20s, and some of us might still think we're invincible. But I think health insurance is for those times where you find out you're not invincible. And it can really make a difference in your financial health and, more importantly, your wellness, being able to recover from those unanticipated challenges up on the ski hill or mountain biking. So you can stay on your parents' coverage till age 26. But after that, you're able to enroll on your own. Same tools for those individuals. They do count that tax credit for them in terms of where they live and the income. Age is not a criteria in the tax credit.
And I know that there are folks who will say, well, I missed some of that. Are the agents the best people to call just to get into the weeds of this? I'm assuming they're the subject matter experts.
They are. So our support center can help you get started. But when it comes to selecting a plan, work with an agent in your neighborhood. So over 1,000 all across the state. You can find one in your local area at our website, yourhealthidaho.org. Click on Find Help, put in your zip code, and a list of agents in your area will display.
Awesome. Well, we're out of time, unfortunately. We'll have to get to some of these other questions another time. But Pat Kelly with Your Health Idaho joining us here on the program. Pat, thank you so much for joining us. We do have to take a real quick break, but when we come back, we are taking a look at the Viewpoint on politics. Yes, we're still talking ramifications of the election. We'll be right back after this break.
However you do the holidays, do it together in the Chevy that's right for you. The strong and capable Chevy Silverado, the award-winning Chevy Equinox, or the all-new Chevy Trax. This holiday season, do more together in a new Chevy. Get 1.9% financing on all 2023 Silverado 1500 pickups, or use your Red Tag bonus cash to get $67.50 total value on this Silverado. Chevrolet. Together, let's drive.
Fred Meyer gives you so many ways to save, on top of our lower-than-low prices. Enjoy over $500 in savings every week with digital coupons. Earn fuel points to save up to $1 per gallon. And with a Boost membership, you'll save even more with double fuel points and free delivery. Plus, our weekly sales will keep your budget merry and bright. So get rewarded and save. Fred Meyer, fresh for everyone.
I'm Rebecca, and you might know me from reality TV.
And this was my stubborn body fat that I just couldn't get rid of. But then I went to Sono Bello, and they permanently removed my body fat in just one visit.
It is so intensely gratifying for one visit to make this big of a change. It's amazing.
Sono Bello's board-certified surgeons use micro-laser technology to safely target and remove your diet-resistant fat cells permanently on your stomach, hips and thighs, back, and so much more.
It feels incredible to look down and it's flat.
Thank you again, Sono Bello. I'm so happy.
Schedule your free, no-obligation consultation and find out how you can get $250 off instantly. Call 1-800-815-6629 or go to sonobello.com.
Welcome back to Viewpoint. Hey, there's always a caveat given on election night that it's sometimes visible on the screen and it shows results, but the results we show you on election night, they're actually unofficial until they are certified, and that certification happened this past week around the state of Idaho. Even then, though, the election season, it's not over, since some places will still have a runoff election. And that's because the candidates in the mayoral races didn't get the required number of votes to win. So in Eagle and Mountain Home, we know that both will be having mayoral runoffs on December 5th. So coming up soon in those areas, neither candidate got 50% plus one vote. So Mountain Home and Eagle, we know there will be mayoral runoffs, but there's another spot in Idaho waiting to see if they still need to hold a redo. That's Jerome County. In Jerome, they found that 2 voters, they were issued the wrong ballots absentee. In those 2 votes, it could actually swing the result of a local school board election, which came down to a 1-vote margin. Maybe you're thinking, Jerome County again, didn't they have some election issues last year? They did, but these are totally unrelated. But an interesting twist in all of this. There's actually a brand new law that's going to address what happened in Jerome County, and it's an Idaho law being used for the very first time. You've heard the elections tagline, every vote counts. Well, Jerome County is seeing that firsthand. In the Valley School District, the Zone 4 trustee election finished 48-47. And while examining the election results, the Jerome County clerk found that 2 voters, a couple that lives in the same house, they were incorrectly issued an absentee ballot for trustee Zone 5, but they actually live in Zone 4. And those 2 votes could totally change the election.
Now what they're going to do is they're seeking judicial review.
Idaho Secretary of State Phil McGrain is working with Jerome County and the courts to utilize a law passed in 2022, the Judicial Review of Election Results. It's a law that McGrain is very familiar with.
After some elections I went through at Ada County, we actually got this law passed to allow, rather than requiring a candidate to challenge an election or a voter to contest it, this allows the clerk to actually go to the court and just, as an open book, say, here's what happened, here's what took place. Can the court look at this and determine whether this mistake would have impacted the outcome of the election?
This is also the very first time the Judicial Review of Elections law is being used.
I was very active in getting this in place because we'd seen issues in the past where we wanted a court to look at our work and be able to review it, but there was no legal mechanism to do that other than someone contesting it. And so now this will actually be the first test of going before a judge, sharing all the information, allowing anybody who's been involved, so the candidates, any other interested party, to see what took place. And then I think that likely in this case, we may be headed towards doing a new election.
So how will this all play out? McGrain says there are a lot of considerations.
That is still being figured out. I think one of the interesting things in this particular case is we do have 2 runoff elections coming up on December 5th, both in Eagle and in Mountain Home. I think there's an interest to try and align this. Now, there's a big question on whether this will go through the court proceeding fast enough to make that happen. But, with the holidays and everything else, we're trying to figure this out. I also think one of the determinations in this process is not just how close the election was or what happened during that process, but anytime you are asked to redo an election, there's no way to create the same circumstances. There's no way to get all the same voters to show up. So it's always going to be an imperfect solution to whatever came up. And I think that's one of the challenges the court will have to work out here as well.
Elections are human run, and that will leave room for human error. Catching mistakes, though, it shows an important part of the process.
I think being able to show some light on it, one of the greatest things of this review is we get to just let everybody see what's happening on the inside. And I think that's really important in terms of building trust in our elections. They are scrutinizing to such a level that they can make determinations like this. Like, of course, and I can assure you, the county wishes they'd just gotten it right the first time. I'm sure the candidates do as well. But we want to make sure that we do get it right. And so this gives a chance for them to try and make sure the record's corrected.
So this is the actual judicial review paperwork. I know it's black lettering on white paper, so you can't really read it. But I was in touch with Michael Sieb, who's the deputy prosecutor for Jerome County. Spoke with him this week, and he explained to me that Jerome County will simply be waiting to hear from the court as to whether it feels it can decide the matter with simply the information that's in this petition, or if the court will want to schedule some type of a hearing to get more information before it makes any final decision. So you may be wondering, why not just have the 2 voters that got the wrong ballots re-vote? Well, instead of having a whole election again, that could be any idea. Well, it's actually against the Constitution, and voters, they have the right to a secret ballot, and that needs to be protected. There's actually a movie called Swing Vote. Kevin Costner's in it, and spoiler alert, but the plot is that there's an error with his ballot in a presidential race, so long story short, he gets to get the last vote. He gets to recast his vote and decide the election. And so talking with the Secretary of State, talking with election officials, they say that would never happen in Idaho because of the parameters in the law. Again, everyone is provided for a secret ballot. Well, thank you so much for joining us here on this week's edition of Viewpoint. We are excited to get into the holiday season with you here at KTVB. For now, though, we'll sign off. We'll see you next week.